Up to 500,000 people in the UK could die.
So this is where we would have been heading if the government had stuck to its policy of simply isolating people with coronavirus symptoms at home. Demand for critical care beds would have far outstripped even the surge capacity of the NHS as soon as mid-April.
Don't panic, don't panic! What do we do?
We want to discharge the patients to free up beds.
Many of their residents have confirmed COVID-19. Sent here from hospital, not by accident. It is all part of the plan.
Between the 1st of March and the 21st of April, 3,599 people were discharged from hospital into Scottish care homes. The majority, nearly 82%, were not tested for COVID-19.
In the past week, on its own, more than half of all COVID-related deaths, 338 of the total, were in care homes.
Cathy, as you say, it's a truly troubling landmark, this, that care home deaths in Scotland are now overtaking hospital deaths for the first time.
Why was it allowed to continue? And not just in one care home, all over the place. Unacceptable. You wouldn't do it to animals.
Scotland's had almost 3,000 COVID-related deaths, with almost half in care homes. Today, a new report showed that from March to the end of May, 123 people were discharged from hospitals into care homes, even though they were known to have tested positive for COVID-19, and 3,000 more weren't tested at all.
Brand new hospital with over 500 non-medical staff and no patients.
Oh, there is one patient.
One?
Yes, the Deputy Chief Administrator fell over a piece of scaffolding and broke his...
That would be tantamount to importing death into care homes.
There's been around 2,000 deaths linked to COVID in Scottish care homes. Tonight, we can reveal a major police investigation is actively underway, its scope eventually to investigate them all.
These are the very first details of what's been called Operation Copper. Care homes are being given 14 days by police to produce reams of information about COVID deaths.
It may be decided that the death should be the subject of a fatal accident inquiry or prosecution.
But today's report found the discharge policy wasn't responsible for COVID outbreaks inside the homes.
The analysis does not find statistical evidence that hospital discharges of any kind were associated with care home outbreaks.
I will not let you dishonour their memories by pretending you had nothing to do with it.
But many of those working in care homes say today's report doesn't tell the whole story.
It's very difficult to determine how a virus gets into a care home. But certainly some staff in some care homes, and it is a minority, believe that hospital admission was a key factor.
You said you didn't know what was going on.
Yes, we knew. Well, firstly, the Scottish Government is responsible for the guidance that guided when and in what circumstances people were tested. And up until, I think from memory, the 21st of April, we did not have a policy that tested everybody discharged from hospital to a care home.
Public Health Scotland's report says hospital discharges were not statistically significant in COVID outbreaks, but a whistleblower carer told me what happened when his home was sent one COVID-positive patient.
24 hours after the patient was sent from hospital, he was given a COVID-positive test. From there, in every unit, someone had COVID. How do you ask someone with dementia to stay in their room? To stay in isolation? It's against the law to lock them up.
Care home deaths have been a scar on Scotland in this pandemic. This report today is about lessons learned, albeit too late, for more than 1,000 elderly people and their grieving relatives.